Good afternoon. Before I begin today's announcement, I would like to begin with words of sincere condolences to Her Majesty the Queen and our royal family on the passing of His Royal Highness, the Prince Philip, the Duke of Edinburgh, at 99 years of age. As a young man, he experienced great loss and adversity, but none of that kept him from a life of duty, sacrifice, and service. Prince Philip was one of the last members of the greatest generation, having served with great distinction in the Royal Navy to defeat fascism during the Second World War. In fact, during that war, his mother, the Princess Alice, risked her own life to hide Jews from the Nazis, earning her the status of righteous amongst the nations granted by the State of Israel. His Royal Highness gave up a promising military career to devote himself completely to the support of the Queen and the royal family and to public service. He supported countless charities across the Commonwealth and participated in over 22,000 public events, including 9 visits to us here in Alberta. The images of the time that he spent with First Nations, or at the Calgary Stampede, or even at an Edmonton Eskimos game demonstrate how much Prince Philip reveled in Alberta's frontier spirit. His entire life was one of devotion to family, to duty, and to country, virtues that may be old-fashioned but should never go out of fashion. I'll have more to say during a statement in the legislature on Monday, but for now, let me simply express on behalf of Her Majesty's Alberta government our profound sympathy to the Queen and her family, to the Queen in particular, who has served our country with dignity and grace for nearly 7 decades. She said on the occasion of their 50th wedding anniversary that Prince Philip, quotes, has quite simply been my strength and my stay for all these years, and I and his whole family, and this in many other countries, owe him a debt greater than he would ever claim or we shall ever know, unquote. And so, in the words of Scripture, well done, good and faithful servant. I'm here today with Minister of Education Adriana LaGrange to share an update about the rapid testing program in schools. But before that, I have some very good news to share. Today, our vaccine rollout is taking a big step forward. To date, more than 818,000 doses of vaccine have been administered in our province. We've been getting vaccines into Alberta's arms just as quick as we can. The greatest limit on our vaccine rollout is the lack of timely, consistent doses. The vaccine supply hasn't been predictable, so we've had to delay our plans many times, which means longer waits for Albertans. But we are forging ahead, using up whatever supplies we get to protect as many as Albertans as possible, as fast as we can. More than 400,000 doses have arrived in the last week alone. And as more vaccines arrive, our rollout is expanding. That's why earlier this week I announced our four-part vaccine ramp-up. That started with everyone in Phase 2B, that is people with underlying chronic health conditions being eligible to book a COVID-19 vaccine as of this past Wednesday. Secondly, we made the AstraZeneca vaccine available to everyone aged 55 to 64, with bookings starting earlier this week. And thirdly, we've set up big rapid vaccine clinics in Grand Prairie, Fort McMurray, Red Deer, Lethbridge, and Medicine Hat, with expanded clinics to open in Edmonton and Calgary on Monday. Lastly, we're working with pharmacies across the province to open up walk-in vaccine appointments. I understand that a few have already begun doing so, with many more that will follow early next week. We are speeding up vaccine rollout in response to the third wave of COVID-19 in Alberta. In fact, yesterday, we reported a record high of 39,000 doses administered. And that brings us to today's good news. I'm pleased to announce that nearly 250,000 healthcare workers and associated staff will be able to start booking for their first dose this coming Monday, April the 12th, in just 2 days. That's on top of 55,000 hospital staff and paramedics, including staff and doctors in COVID wards, ICUs, emergency and respiratory therapists, roughly half of AHS staff, and 33,000 continuing care staff, around 90% of whom have already received the COVID-19 vaccine. with about 80% in both of those groups having received their second dose. So today is the first step in beginning phase 2C of the vaccine rollout. Hospital staff, both on the front lines and behind the scenes, are ready to move to protect this next group. I'd like to express my thanks to them for working so hard to keep the vaccination program running smoothly, even though through system and supply challenges. I'm grateful for their dedication. Starting Monday, community physicians, nurses, pharmacists, dentists, and other healthcare professionals like chiropractors, massage therapists, physiotherapists, and optometrists will be able to book their vaccination. To support and associated staff of the healthcare professionals that I just mentioned are also now eligible, and this includes reception, cleaning, and security staff, so that we can make sure that these healthcare workplaces are protected in their entirety. Other parts of the healthcare system not yet covered in our phased vaccination plan are also now eligible. This includes anyone working in patient care facilities or providing services directly to clients in the community for Alberta Health Services, for Covenant Health, Alberta Precision Labs, DynaLIFE, and students doing practicum in clinical areas. Healthcare workers on First Nations reserves will also be able to book. The full list of healthcare workers that are now eligible in the first rollout of Phase 2C can be seen at the alberta.ca website. As always, our focus is on protecting those most at risk of severe outcomes and of stopping the spread. These healthcare workers care for Albertans when they are most vulnerable. By vaccinating them now, we'll help to prevent COVID-19 from spreading to those at highest risk of severe outcomes. This is another important step forward, but it's just the start. Due to limited supply of vaccines, all other groups in Phase 2C will become eligible as Albertans receive more supply. So as of Monday, more than 1.7 million Albertans will now be eligible to get the vaccine. To all of them, I say, if you haven't done so yet, please go out and make your appointments and book as quick as you can. Pharmacies and AHS staff are ready and waiting to help you out. To everyone else who is still waiting, I say that your time is coming soon. We're going to keep expanding and get you your dose as quickly as possible. Throughout this spring, we're expecting well over 100,000 doses of vaccines to be shipped to Alberta every week on average. If those shipments show up like they're supposed to, we'll be offering every adult a first dose by the end of June, if not sooner. That's less than 3 months away. So the end is near, and every dose we deliver gets us closer to getting back to normal. But until then, we need to protect lives and livelihoods as we continue to face the challenge of this pandemic. And now that brings me to today's second announcement. We all know the critical role that schools play for the development of young Albertans and for our economy, and that's why we've worked so hard to keep schools open throughout a majority of this pandemic while protecting students and teachers and staff who work there. To ensure schools are able to operate during this third wave of COVID, we're significantly expanding rapid testing to more schools and regions of the province as soon as possible. The screening tests will roll out to potentially hundreds of schools in Calgary, Edmonton, Grand Prairie, and Lethbridge, communities that either with obviously large populations or where we've seen more transmission in schools. We could be testing all junior and senior high schools at the public and Catholic school boards in those communities if the need, in other communities if the need is there. This is significant. We're taking about 400,000 rapid tests for as many as 20,000 students and 200,000 students and 20,000 staff. So that's 400,000 rapid test kits that will be administered to about 300 schools to support tests for about 200,000 students and 20,000 staff. So to put this in perspective, it's almost a third of all students in Alberta who we think will benefit from this. We'll also be flexible when needed. If there's a school outside of these 4 communities that needs rapid tests, we'll do our best to make that happen as well. Now, I know that some parents and school staff are understandably anxious about the recent rise in cases in schools. It's important to look at the data and listen to the expert scientific advice. As Dr. Hinshaw, and other chief medical officers across the country have said, COVID does not pose a significant health risk to children, no more so than the regular flu, and there is very little evidence of in-school transmission. In fact, since Christmas, we've identified in-school transmission in 374 schools, or 15% of all schools, and half of those resulted in only one case occurring. So this term, we've identified 1,373 cases of in-school transmission, which represents about 0.12% of all students. So just to put that in perspective, 85% of schools and 99.9% of students have not been affected by in-school transmission. But as we all know, the spread of COVID-19 in our communities is reflected in schools. And we are taking measures this week by bringing in more targeted public health measures that we announced last Tuesday, and we're taking more actions in our schools, such as today's announcement. Rapid testing is one more tool to limit the spread of the virus in schools during this third wave. We are one of the first provinces to arrange for testing teams to set up in schools during the school day and actually to administer the test to students and staff. This option takes more time and considerable effort. And let me just pause there to say, some people may say, well, why are you only doing 400,000 instead of covering all of the students in all of the schools? And the answer is there simply isn't enough capacity in terms of people with the training to administer these tests. But we're going to the maximum that we possibly can with the resources that are available, bringing in private sector vendors and having them train additional people as quickly as possible. But this is the right thing to do. It is a more effective way to administer the program, and we want these tests to work well in a school environment. We're making close to 500,000 test kits available for the school testing program, as I've said, and rapid tests can offer a real-time check on the situation in an entire school. By using these screening tests in schools, we can potentially detect the virus quickly in students or staff who don't have symptoms, allowing them to isolate and curb the spread of COVID-19. These tests are in addition to the other preventative measures already in place in schools to limit spread. We are all tired of COVID-19 and the challenges that it brings to our lives, including to schools. We all want and need to return to normalcy, and that's why we're committed to safely continue in-person learning to the greatest extent possible. I know everyone from school principals, teachers and staff, to parents and students have been doing their very best to keep schools safe. We thank them. These numbers are a testament to your efforts, and I thank you for your dedication during a school year like no other. And now we're giving you one more tool to support continued in-school learning. Because every day that students are able to attend school is a win during this pandemic. So I'll now turn to Education Minister Adriana LaGrange, who will share some more details about the rapid testing program in schools. Adriana?
Thank you, Premier, and good afternoon, everyone. I am pleased to share with you more details on rapid testing in schools. Testing is an important tool to limit the spread of the virus within our schools and ensure the safety of students and staff. That is why we are expanding to more schools and regions following the successful pilot in 2 Calgary schools over the past few weeks. As the Premier said, this would be, or could be, upwards of 300 schools that serve 200,000 students and 20,000 staff. We were able to learn from the experience of the pilot, such things as how long it takes to test a certain number of people. This helped us to determine the potential for the expanded program. We also took the time to consult with health officials on what age groups and communities to target, so that the program can be as effective as possible. That's why we are focusing on students and staff in grades 7 to 12 at the 4 largest school boards in our province, as well as offering the tests in communities where there is need, such as Lethbridge and Grand Prairie. But the program is not limited to just these 4 communities. We plan to offer the screening test to schools in other communities if the need is there, through our rapid response teams. I know parents and staff will want to know when testing may be available at their school. I ask for your patience as we sort out the details of when and where, and then allow time for schools to gather consent from their students and their staff to participate. We are working closely with school boards and testing teams to make this happen as soon as possible. Testing will take place first in Calgary and Edmonton, followed soon after in Lethbridge and Grand Prairie. A variety of factors will go into the order of testing for the schools that are selected. This includes how prevalent COVID-19 cases are in the school and the surrounding community. We also look at whether a school had multiple outbreaks and alerts throughout the school year. Officials in Alberta Health will coordinate with officials in Alberta Education will coordinate with Alberta Health and with the school boards in the selection process. Going back to the pilot, my department received very positive feedback from the 2 Calgary schools, and we will continue to seek feedback about the testing program as we move forward. We are committed to ensuring in-person learning remains safe, and we are working very closely with school boards on dealing with the challenges that arise. As we move through this unusual school year, I'd like to take a moment to thank everyone involved in the school system, students, parents, teachers, administrators, and all staff, for they have been doing their absolute best during what has been a very challenging and complex year due to the COVID-19 pandemic. No one could have anticipated what we would have had to deal with, and I thank them from the bottom of my heart. As the Premier said, every day that students are able to attend school in person is a win for all of us, especially our students. Thank you, and I believe we'll be taking questions.
Thank you. Thank you, Premier and Minister. That moves us into the Q&A portion of the event. Just for everyone on the line, please limit yourself to 2 questions off the top, or 1 question and 1 follow-up. Operator, can you please put through the first caller?
Thank you. The first question is from Dylan Short, Edmonton Journal.
Hi, I believe this is a question for the Premier. You spoke off the top about vaccines and how we're obviously aiming at getting jabs into the arms of the most vulnerable. But then you went on to speak about keeping schools open. So I guess my question is, why are teachers not being given any priority to receiving vaccines if we're going to keep them in classrooms in large groups with students?
Well, our vaccine rollout is based on the scientific expert advice that we have received both from the National Scientific Advisory Committee and the Alberta Scientific Advisory Committee, and that advice has been confirmed by Alberta's Chief Medical Officer for Health. Those scientific panels are looking at the criteria of people who are most likely to suffer negative outcomes from COVID-19 and how best to limit the spread as well. So we are not going to do this based on sort of arbitrary pressure, but rather the scientific advice. When it comes, for example, to age is by far the strongest indicator of potential negative outcomes from this virus. I understand that somebody who is 80, for example, is about 1,000 times more likely to exhibit or experience severe outcomes, and including potential fatality, than somebody who's 20. So you could have, for example, a 25-year-old teacher who is very healthy and whose risk of negative outcomes from COVID-19 is statistically negligible. But to put that person ahead of the queue of, let's say, a 65-year-old senior with underlying chronic conditions would be a real misallocation of the scarce supply that we have. We wish we could vaccinate teachers and everybody as soon as possible, but it depends on supply. And when the good news is that we're finally starting to get some decent supply, and we're responding by ramping up our vaccine program.
Thank you. Dylan, do you have a follow-up?
Yeah, I guess it's a separate question, not really a follow-up. But anyways, earlier this week we saw AHS shutter the Grace Life Church in Parkland County. So this Sunday will be the first time that there'll be, or some sort of service, I'm guessing, since the shuttering. There's already been, posts online of several well-known people coming to support the church tomorrow. I guess for tomorrow, speaking to these individuals that attend the church as well as people that may be coming to support the church, do you have a message for those individuals, Premier?
Well, my message for any Albertan would be to take COVID seriously and to keep people safe. My message to people of faith in particular would be, if you believe in the sanctity of human life, please act accordingly. This virus is real. It's taken the lives of 2,000 Albertans, of millions of people around the world, and we are right now in the midst of what is likely the biggest wave of infection that we've experienced today. So if people are going to gather anywhere, including perhaps for outdoor gatherings, please follow the public health guidelines to stay physically distanced, at least 2 meters between family cohorts. Please wear masks. Please avoid physical contact, and to keep each other and the broader community safe. It would be tragic if a gathering would result in a super spreader event. I also say that Alberta, the irony of this case is that Alberta has had the greatest protection for the exercise of religious freedom, including the freedom of worship, of any province in Canada. This province has never suspended congregational worship. We have had limits on capacity, just like we do for fire code. But unlike most Canadian provinces, we have never shut churches or other places of worship. We have about 10,000 places of worship in Alberta that have worked very hard to comply with the guidelines to keep their congregants and the community safe. We have apparently one, maybe a couple of others, that have refused to do that. And I think it's ironic that in the province that has maintained the greatest freedom of worship, because the government is reluctant to impair constitutional rights, that this kind of event is happening. So I would say, thank you to the 10,000 faith communities that have carefully followed the guidelines as best they can to respect the sanctity of human life and to protect the vulnerable in our communities.
Thank you. Operator, can you please put through the next caller?
Thank you. Carlisle Fizette, CTV.
Hi, thanks for taking my question. I'll start with a question for the Education Minister. So far, at least 9 school boards have come out in opposition to the curriculum. They will not pilot the new curriculum this fall, and the pushback against it appears to be growing. What is your message to those school boards, and I guess why do you think they perceive this as going the wrong direction with this curriculum?
Well, thank you for the question. When I look at the fact that this is a draft curriculum, first and foremost, and that we've given maximum flexibility to all school divisions to pilot, whether they want to pilot a subject or whether they want to pilot a particular grade or whether they want to pilot the whole thing, we have said we will work with you, we will be flexible, and so now it's in their ball court as to whether they choose to pilot or not. But that being said, what we find is that those school divisions that are going to pilot it, they will be able to provide us that rich feedback. While we will get feedback from CBE and others who do not choose to pilot, the actual rich feedback that we will get from teachers on the ground actually putting it into practice will be indispensable to us. And so I'm looking forward to working with all of those school divisions. Yes, we will gather that information from those who choose not to pilot, but the ones that choose to pilot will be leaders, and they will be able to give us that rich feedback that we're looking for.
Do you have a follow-up, Carla?
Yeah, one more about the sort of again on the line of schools here. I know you said that the teachers, there's a wide range of age. I guess this is for the Premier. But when it comes to vaccinating teachers, I know it's a supply issue. You'd love to vaccinate everyone, of course. So how far away are you from getting the supply you need for teachers to be included?
Well, first of all, teachers are included. If there are teachers with underlying health conditions or teachers over the age of 55, they are eligible for the vaccines. Any teacher that's 55 to 64 can get the AstraZeneca. Any teacher at any age who has an underlying identified health condition hopefully will already have obtained the vaccine. And in terms of healthy younger teachers, they'll be eligible as we are able to move the age categories down, and that will depend on forthcoming supply. But most of those folks would fall into phase 3. And once we get to phase 3, perhaps an argument could be made there that we should prioritize people in certain professions who can't stay home. And we're contemplating that. We'll take the advice of the Scientific Advisory Committee. But let me just say, once we get to that point, we will have so much supply that really we may end up significantly slowing down the vaccine program if we create several separate queues, because it wouldn't just be teachers, it would be all sorts of people who have to work outside the home, grocery store clerks and taxi drivers. You could name hundreds of thousands of people who fall into occupations where they're interacting with the general public. And so if we were to set aside a sort of phase 3A for everybody who is working outside the home, that would create additional complexity and potentially delays. But we'll keep that in mind, and we will certainly respond if the federal and or provincial scientific advisory committees recommend this. We would certainly adjust course.
Thank you. Operator, can you please put through the next caller?
Nicole Stilger, Global News.
Hi, thanks for taking my question. This is for Minister LaGrange. As the Premier said, what happens in the community is a reflection in the schools ultimately, and given what's happening in the community with the skyrocketing spread of variants, what's the plan to stop in-school transmission, and especially while we wait for this rapid testing to roll out, would there be plans to move students back online?
Well, the plan all along has been to protect the safety and security of our students and our staff right from the beginning, from the day we opened our doors in September. And that plan, that robust plan that we rolled out then, is still continuing to work. We work very closely with Dr. Hinshaw and her team, as well as the school authorities and my department. They're in constant contact that if we need to adjust in a different manner, we will. We'll pivot very quickly. There's been some schools that we've had to pivot to online learning or extend a spring break because of the number of students and staff that have had to isolate, or logistical issues with not enough substitute teachers. So that continues to happen. We have a very robust plan that is able to be nimble and react very quickly, and we're continuing along that path.
Do you have a follow-up, Nicole?
Just a quick one. Is contact tracing being bolstered just to deal with the increase of the variants?
We have excess capacity, is my understanding, within contact tracing across the province. That's been built up very deliberately by Alberta Health, and it is working. I continue to hear from school divisions and school authorities that the turnover time from the time that a student or a staff member is diagnosed with a lab-confirmed case of COVID, that within 24 hours to 48 hours they're being notified, and as is the school. So the contact tracing has really stepped up, and we really thank the great work in Alberta Health for doing that. And I understand there's excess capacity at this point in time still.
Just to add to that, we, since January, have had a designated contact tracing team for school investigations. And so we've taken some of the most experienced contact tracers to lead school investigations, given that that's obviously a priority. And Alberta Health Services informs us that they currently have capacity to complete as many as 2,000 investigations a day. Now, and that's, let me tell you, there's been a lot of heavy lifting to get to that stage, up from a daily maximum of a few hundred cases several months ago. Now, having said that, to be clear, I am concerned that we could very well start cresting beyond 2,000 new daily cases in the foreseeable future. So our contact tracing system may be challenged again, but in that context, we would continue to prioritize school investigations.
Thank you. We have time for 3 more. Operator, can you please put through the next caller?
Liam Verster, Everything GP.
Hi, good afternoon. I may have missed it, but what exactly for this rapid test screening program, what exactly is the timeline? When do we expect to see the tests available in the schools? And if it's going to Edmonton and Calgary first, then when are the other school divisions going to be able to get theirs?
Adriana?
Yes, thank you. The rapid testing pilot that we had going in Calgary in the 2 schools is already expanding to 4 schools, additional schools this upcoming week. That provider, that vendor, is already ramping up his capabilities with new teams. And as we bring on a new vendor, once the contract is signed and they're able to hire trained staff, that will ramp up as well. We're expecting by mid-April that all school regions will have teams on the ground testing, and by mid-May that we would have 100% capacity for all teams to be testing, and I believe that will be in all 300 schools. Of course, it will take time to go school by school. Roughly, they can do about 600 tests per day per team, and it depends on the level of interest that we get from schools. In the pilot, we found that 60% of students and staff consented to having the tests done, or their parents agreed to having the tests done. So again, dependent on the numbers, how large the school is, we look forward to getting up to that 300 capacity as soon as possible.
And could I just add that the government has challenged the Department of Education, as the minister will confirm, to roll out as quickly and as broadly as possible. I mean, as I said, in an ideal world, we would get to 100% of schools immediately. But the reality is that the government resources are completely allocated already, administering our huge PCR testing program, where we're now back up to doing 15,000 tests a day or more, plus the huge vaccine program, where we're now administering about 40 to 50,000 vaccines a day. And so we have, for a supplementary program like this rapid test scheme, we have to go outside to get technical assistance from the private sector. Let me explain. I must confess that at first I had a misunderstanding about this. I thought the rapid test kits were simply those sero tests where you'd simply get a little bit of blood on the finger and put it in a kit and get the result. I thought that didn't require a lot of staff training time or expertise, but I understand that it actually does require a swab. And so people do require some level of medical training to administer these tests. And I can confirm that the Department of Education has searched far and wide to find private sector vendors and partners who could deliver this for us. And the most capacity that we can find in the Alberta private sector in this regard allows us to administer, we think, about 400,000 rapid tests in the balance of the school year.
Liam, do you have a follow-up?
Yeah, okay, then what? You're just going with the not post-secondary, high school and junior highs. What made you guys decide to go with these schools over other schools in the divisions?
Right.
Adriana?
So that is because of the fact that we are seeing larger numbers. School COVID cases are a reflection of what's happening in the community, but we also see that our junior highs and high schools tend to have higher numbers. When I look back at the number of schools that have had to go to online learning because of logistical challenges, higher isolation numbers, etc., the vast majority were in our junior highs and high schools. So they are the ones that we're targeting first, but that doesn't eliminate the fact that if there is a concern, an outbreak in a elementary school or say a K-9 school where there's only, several grades that are in that category, that we would not test the whole school and that we would not deploy our rapid testing team to that school. We want to ensure that we are meeting the needs of the communities where we're seeing higher prevalence, but of course also being able to target those hotspots as needed with our rapid response teams.
Thank you. Operator, can you please put through the next caller?
Thank you, Elise Von Shields, CBC.
Hi, thanks for taking my question. This is for the Premier. Do you anticipate that the rapid increase in spread of variant cases is going to require any adjustments to the details of upcoming steps of Alberta's reopening strategy?
Well, the reopening strategy is on hold indefinitely until we stabilize the spike in cases. So the path forward that we published at the end of January obviously was linked to declines in hospitalizations, and now we're going in the opposite direction with most recently 330 patients in hospital with COVID. But we do expect to see significant increases from that number because of the spike in new cases over the past couple of weeks. In fact, it's over 5%. The ratio between total active cases and hospitalizations in the last month or so has been about 5%. So if we have 10,000 active cases, to give you an example, we can reasonably expect to see 500 hospitalizations or more about 2 weeks later. There is the lag effect. So we are not going to be relaxing measures. We, as you know, on Tuesday made the very difficult decision to bring in additional targeted measures. But at the end of the day, the only thing that's going to stop the increase in these variants is Albertans as a whole deciding to stop social interaction, to follow the public health guidelines. If we can do that, the vaccines will catch up to the variants more quickly. And then we can go back to reopening with the confidence of the protective effect of the vaccines much more quickly. So now, having said all of that, I did lay out on Tuesday the kind of what the next 3 months could and should look like. As we build up population immunity through the vaccine program, and once the vaccines catch up to the variants, we absolutely can get back to normal this summer. We anticipate that we can get to something like 70% protection of the population, either through first and second doses and or immunity acquired through natural infection by the end of June. And I laid out some pointers about what that means. In other words, I believe we're going to have a Calgary Stampede. We're going to have outdoor events. We're going to have most of these restrictions lifted gradually through May and June. But we've got to get through the next few weeks and beat this spike.
Do you have a follow-up, Elise?
Yeah, I do. You'd mentioned that the vaccine rollout for adults could happen sooner than the current goal of June 30th. I'm just wondering how much sooner you think that could happen.
Depends all on how many doses that we get. All I can tell you is that AHS now has a plan to administer upwards of 70,000 doses a day. That's our stretch goal. So we think that we can, if we get the doses, we think we can do 400,000 to 500,000 jabs a week. And so really the only thing holding us back is dosage. Now, one of the reasons I can't give you an answer is because there are new vaccines coming on stream, the Johnson & Johnson being one example. It's a very efficient one-dose protocol. And if we start getting, another thing we don't know yet is what level of public take-up there will be around the AstraZeneca, given the concerns that have been raised. We may not get, we may not be able to administer our entire AstraZeneca inventory. So those are just unknowns, but I would say that based on the best projections from our public health team, we can see Alberta lifting the majority of our public health restrictions in the month of June.
Thank you. Operator, can you please put through our final caller?
Thank you. The final question is from Mirna Vukic, Radio Canada.
Yes, thank you for taking my question. For the Premier, comment vous répondez, Monsieur le Premier ministre, face à la hausse des cas et puis au fait que ça touche quand même une population plus jeune avec les variants, aux gens qui sont inquiets en ce moment d'envoyer leurs enfants à l'école? Pensez-vous que cette annonce d'aujourd'hui sur les tests rapides va suffire à les rassurer?
Merci. Aujourd'hui, nous avons annoncé les tests rapides pour les écoles à 400 000 de ces tests qui seront dispersés, particulièrement dans les régions plus affectées par le COVID-19. C'est un autre niveau de protection pour les écoles qui est essentiel. Mais je comprends très bien l'inquiétude des parents et des enseignants en ce qui concerne la croissance de COVID-19 dans les écoles. Mais cela étant dit, 85% des écoles n'ont aucune preuve de virus dans ces écoles-là. Et nous avons seulement 1400 cas d'infection dans les écoles. Ça veut dire que 99% des étudiants n'ont pas touché par le virus, la transmission du virus à l'intérieur des écoles. Et finalement, les données scientifiques sont claires que le COVID-19 ne pose pas de menace aux santé des enfants. Et effectivement, c'est clair partout au monde que ce n'est pas une menace à leur santé, mais évidemment, la dispersion de virus dans les écoles est une réflexion de ce qui arrive dans la société générale.
Thank you, everyone.
Thank you. Merci.